Our second speaker today is going to be Dr. Jenny Dyke, and she is going to be talking about managing animal health in the lambing and kidding season.
All right. Hi, everybody. Thank you for the introduction, and thank you for that great talk, Brett. Thank you also for your assistance in the technology here. We're a year into this pandemic, and this is my very first Zoomy meeting, so I hope it goes well. Anyway, I'm going to focus my talk primarily on the first 48 hours. You know, we see this nice picture right here. This is what we want to get to. So how are we going to get there? I'm going to be talking about basically avoiding the 3 major causes of lamb death in the first 48 hours. And those include dystocia and starving and hypothermia. So we'll talk about those individually. Yeah. All right, so here we start at the birthing ewe, recognition of labor. First off, stage 1 of labor you won't see anything physically. It'll all be internal changes. Uterus will start to contract, cervix will begin to dilate. You might see some outward behavioral signs if you're watching closely that may include the ewe distancing herself from the herd, going off feed a little bit, sniffing, pawing at the ground. She's looking for a good place to have her lamb. So oftentimes you can recognize the first stage of labor and get her in, if she's not already, get her into a warmer, safer, more controlled environment for the actual delivery. Stage 2 of labor, and the first stage generally takes 3 to 12 hours before you're gonna, and that ends with the beginnings of mucoid discharge from the ewe. So stage 2, that's when the magic happens, labor and delivery. In a normal ewe, that should really take no longer than a couple hours, generally 15 to 30 minutes per lamb. And then stage 3 of labor is the placental passing and the involution, or the shrinking up of the uterus internally. And that normally takes 0 to 6 hours. So here is the slide I will spend a few moments on. This is dystocia. Everybody knows what that is. That is, when there is a problem with delivery. The lamb is not coming out smoothly and naturally on her own, and she requires some intervention in order to get the lamb out successfully. And why does this happen? There's a bunch of different reasons. It can be a size discrepancy. We could have a giant lamb or kid and a small ewe. Abnormal presentation, malpresentation is a big part of that, and I'll go through a lot of the common presentations. Dilation problems, not as common, but we can see that from time to time. Multiple lambs getting tangled up, and then weird things, rare things like deformed lambs with extra limbs or heads or whatnot. So I'm going to start out with the cardinal rules of labor and delivery with human intervention. And that is, number 1, be safe, both physically and in terms of microbial contamination. Some of the diseases that are zoonotic, meaning that you can be transmitted from animal to human, can be high in the late delivery fluids, placental fluids, all that stuff that comes out with labor. So be safe. Have her confined in an area where you're not going to get smashed around. Have help available. Wear your gloves. Be clean. Wash your hands. And be gentle. Use lots of lube. You can never overdose on lubrication. So I will just start up here at the top left corner, and that's our normal presentation. Folks refer to that as the Superman presentation with head coming and both front legs extended completely fully. That should be a no-brainer, should come out normally. If the ewe is tired or it's a big lamb, you might need to apply some gentle traction. A word on traction, we in school, for folks that are more in tune to calving or the bovine world, we always learned in school the two strong man theory. So two strong men pulling, you shouldn't have to pull any harder than that. That's for cattle. Sheep and goats, small ruminants, I'm more on the one strong woman theory. I can crank probably as hard as I can, but I don't want somebody else also cranking on that lamb. If they're not coming with what I can pull normally, then there's something else wrong and I need to investigate what's going on inside. So dropping down to hind legs only. This is a posterior presentation. This is also a normal delivery position. We'll see this commonly, generally with no problems, with the one caveat that if you see two hind feet and a tail coming, you don't have a lot of time to get the entire lamb out before he becomes in danger of drowning, because once that umbilicus breaks and snaps, that usually happens at a time when you start seeing the stifles come out of the ewe. He doesn't have that connection to the placenta anymore, and he will start breathing and he can potentially drown in the amniotic fluid. So posteriorly presented lambs that are coming out back feet first, need to be delivered in a very timely fashion. So if you see back legs, you may want to just go ahead and apply some traction and get that entire lamb out with his head so he can get his airway cleared and start breathing on his own. All right, down the row to elbow lock. So this is a presentation where you'll see a head and two little feet, but instead of the feet being extended very far out in front of the nose, you're just seeing them like so. And this is an easy correction. You will feel like a hero. You just gently extend both of those elbows out and the lamb should slide on out. All right, moving on to breech presentation. A lot of folks get worried about breech presentation. It scares folks. But in all honesty, this is one of my favorite malpresentations to correct and deliver. As really, you still have to be gentle. You still have to, be very cautious as you're pulling legs out, that you're not, putting pressure on the uterine tissue or causing any damage to the lamb's joints. But generally, I will use one, after I go in, I'll use one hand, and you'll first identify this. So you'll feel the tail, you'll feel two hocks, and you'll apply pressure to push that lamb towards the head of the ewe. Once you have done that, you will have a little bit more room in order to follow down the hind legs from the from the stifles to the hocks, and then you'll do the maneuver where you unkink that hock. So it's not flexed, it's extended backwards. And then you'll do that same maneuver on the other leg, and then you should have a tail and two back feet and be able to deliver the lamb again in a timely fashion so he can start breathing air on his own. Moving downward to our center diagram, our head back malpresentation. This can be a challenging one, and we basically just need to follow the rules of getting that position back to normal. So you may need to push those legs in a little bit to get some more room, and then you're going to have to identify the head, and I'll put my hand up and over the pole to where I can feel his snout, maybe the eye sockets and the ears, and I will direct that head right in between the front knees, the carpi, so I can deliver him normally. Some folks will use tools like a head snare to help gather that head and get it in the right direction. I generally just use my hands, but if you have a head snare, that can be helpful. We're gonna go up to leg back, one leg back and both forelegs back. And again, we're gonna need to find those legs. Some folks will even use a little bit of a cord, a soft polypropylene cord, or even in a pinch, some baling twine that you've soaked in a disinfectant like chlorhexidine, and get a little half hitch loop around the legs so you can gently draw them out to where they need to be. And then down low, this is when we get, tangles of twins and triplets. And that's when your identification of front legs versus back legs. Do these legs belong to this head or that body? And so if you haven't done a lot of lambing, I encourage you to, if you have a dead lamb or even a live lamb laying around, practice palpating, feeling with your hands, with your eyes closed. Feel what a front leg looks like. Feel what a back leg looks like. Feel, all the different malpresentations that you can imagine, and practice, putting that eye to brain contact. So you'll know what you're feeling. A back leg can be differentiated from a front leg by the way that the joints bend. For example, the front legs, the first joint bends in the same direction as the second joint. But in the back legs, the opposite is true. The first joint bends in one direction and the second joint bends in a different direction. So that was a lot of information about malpresentations. When to seek professional help? Well, like I said, we want to see positive forward progress, meaning, we've got to be making some headway, within every 15 to 30 minutes. If we're not making headway, and if we're intervening and we're not able to correct the malpresentation, we basically come at a standstill. So if you're in there manipulating and intervening for 15, 20 minutes, no luck, then it's time to call somebody, hopefully a professional veterinarian if you have one available, or maybe just someone with more lambing experience. There are some lambing schools out there available to y'all. If you Google it, you can actually, learn a little bit more about the odds and ends and the details. But that is the basic stuff. So we will move on to.
Oh, down there.
Oh, yeah. All right, so now we have got live lambs on the ground, hopefully. Step 2, we got to keep these suckers alive. The first 48 hours of a lamb's life are the most tenuous. That's where we have the most loss. In the first seconds to minutes when the lamb is on the ground, you may need to provide some basic resuscitation and stimulation. This is generally the ewe's job. The ewe should be providing that by pawing at the lamb, licking at the face, drying the lamb off. But if that's not happening, then you need to intervene and wipe away the amniotic sac, clear the fluids out of the mouth with a finger, and be sure that there is a clear airway. And then in terms of stimulation, a lot of times I'll pinch the little philtrum, the little bit in between the nostrils, give that a little pinch. That's an acupressure point that can stimulate respiration. Also taking a little bit of clean straw is a tried and true method, and putting that up a nose, that can stimulate respiration. I do not recommend, and I don't know if anybody's still doing this, but back in the old days, we used to swing lambs around or hang them upside down. If you're doing that, I really strongly suggest that you change your ways, because we know better now. So the best way to provide good respiration for the lamb is to simply put him on the ground in sternal position. That means him upright with his breastbone on the ground and his legs out in front of him. You can also tuck his back legs along his side, and that creates a good place for both of his lungs to respire, and expand without any obstructions. When you hang a lamb or you swing a lamb around, you're really just causing the GI contents, the organs in the abdomen, to put pressure on the diaphragm and make it harder, in fact, for him to breathe. We used to want to clear the airway of lung fluid. That fluid that you see coming out is not coming from the lungs. It's truly just coming from the stomach. So no more swinging lambs. Put them, you can actually Google, it's called the lamb or calf recovery position. You can Google pictures of that. And that is the recommended method of getting the lamb to have the best options for breathing. Bonding with the ewe, these first few hours are very important, especially for your first time mothers, just to get each other's sense and bond up. This is where that suckle barn person is very, very, very important in terms of getting that latch. We'll talk a little bit more about colostrum, early suckling, care of the umbilicus, and hygiene in these next few slides. All right, so hypothermia, freezing, that's a huge cause of lamb mortality. These little guys, they don't have the wherewithal to thermoregulate at this point. Normal temperature for a lamb is 102 to 104 degrees Fahrenheit. Get a thermometer. This is a very cheap diagnostic tool that will help you out a lot. Sure, you can put your finger in a lamb's mouth and say, oh, you're cold, or oh, you feel all right. But a thermometer gives you a better reading of what's going on. So again, normal, 102 to 104 degrees Fahrenheit. Mild hypothermia is 99 to 101 degrees. So we need to get that lamb warmed up. If he will, as he starts moving around and suckling, that will help. But if he's not in that space, getting up and moving around and suckling, we might need to throw him into a interventional thermal supportive mechanism, such as warming boxes. This is what we have here at the sheep station. It's a wood box with an electric heater coming through the back. There's expanded metal on the inside, good ventilation. And actually this morning, I just warmed up a very cold lamb. This guy came in from outside and he didn't read on the thermometer, so I can assume that he was 90 degrees or less. And another option that is not warm air, I will actually take a lamb, put the lamb in its entirety into a thick plastic garbage bag, and then dump that lamb into a little spa. So hot water, no more than like 102, 104 degree water, the temperature of your basic spa, and dump the whole lamb into that bucket of hot water. Don't leave that lamb unattended because we don't want to suffocate or drown any lambs, but keeping them in that plastic bag has two benefits versus just putting them in warm water itself. One, that maintains all of the scent on the lamb, so the ewe is more likely to take him back and remember him when you return him to the jug. Also, it keeps us from having to dry the lamb off again after we get him warm. So 5 to 15 minutes in that lamb spa, and then get him into this warming room. I like to check their temperature with a thermometer every 30 minutes or so, because once they do start warming up, they can warm up quite rapidly. And if we're not monitoring, that can jump up to, overheating fairly quickly. So again, once they are, over 100 degrees, 100, 101, take them back out of the warming room and return them to their mother. Our next slide. This is a quick slide about umbilical care. Most of y'all know this, but the umbilicus, you can think of it as a superhighway from the inside of the lamb to the outside world. And so it's a direct route for bacteria, other pathogens to gain a hold into the lamb's circulatory system. So it's an open wound. We want to dry that wound off and close it up as quickly as possible. So we use a dip, an umbilical dip, or we use an iodine solution Other products that are out there and can be used include 2% chlorhexidine. Naval Guard is another commercial product. The main takeaways, however, are just to immerse that cord, coat fully up to the body wall. Spraying doesn't work quite as well. I like to clip the long cords to 1 or 2 inches, dip them as soon as possible, and then, in 6 hours, if it's still not dried up and crispy, go ahead and repeat that. And this will help mitigate a lot of these things that we want to avoid, like infections, and then other systemic issues that come with having early infections, liver abscesses, joint abscesses, even pneumonia, brain infections, and even decreased average daily gains. So umbilical care, truly important. Now, colostrum intake. This is just the king of everything, critically important. I preach colostrum intake day in and day out. Unlike some other animals, ruminants are born with a completely naive immune system. They get literally no transfer through the placenta of antibodies or immunoglobulins. Everything a lamb or a kid gains in the development of its immune system comes directly from colostrum intake. So that includes a higher fat content, more nutrients, immunoglobulins, white blood cells, all of that. And quantity, quality, and timing are all so important. My rule of thumb is for every pound of body weight that a lamb, their birth weight is, they should intake about 1 ounce per pound of body weight 3 times in the first 24 hours. As the lamb ages, the lamb's ability to uptake all of these incredibly important factors decreases, it drops off. So the first 4 hours is incredibly important. So say a 10-pound lamb should intake 10 ounces within that first 4 hours, and then another 20 ounces in the next 20 hours. 1 ounce of colostrum per pound of body weight 3 times in the first 24 hours of life. And that will put you in good stead in order to keep the growth curve moving upward in a positive direction. And then just briefly to wind things down, a word about environmental hygiene. Depending on how you are raising your lambs, range environments or shed environments are different. Confinement does provide the protection and allows for closer surveillance and observation. But as the lambing season goes on in time, that can lead to more numbers of bacteria buildup. So that just plays on the importance of cleaning, drying. We muck out our jugs every single day. We try, if we have the space, to dry them out for 24 to 48 hours. We'll lime them to help the drying process and destroy microbes. And then we'll rebed with fresh hay for every lamb unit. Ventilation, also very important. Brett talked a bit about this with his orphan talk. So a ventilation system in order to clean out the ammonia gas that builds up to keep the lungs as healthy as possible. Next, what else do I have? And I'm pretty much finished up now. This is just a quick little slide that speaks to the importance of potentially having a dedicated space in order to keep your supplies. I didn't talk a lot about tubing lambs. I don't know if you guys have questions on that or not, but that is an incredibly useful tool if a lamb does not quite have the suckling reflex yet to get nutrition into him. There's good YouTube videos out there, or talk to somebody who has tubed a lot of lambs, and that's a life-saving nutritional intervention. So a place to keep stuff out of the way so people aren't tripping over it. Keeping your personal protective equipment, your disposable gloves, all your other lambing supplies, medications that are needed without, freezing or getting too hot. Having heat and electricity, hot and cold running water, refrigeration, and even laundry is, sometimes that might just be your house, but if that's not an option, having a dedicated place for that is a phenomenal aid and assist in order to have a successful lambing season. And then, of course, just biosecurity. Lambing season is an amazingly adorable time. We want to show off these bouncing, babies to everybody, but it's not the best time to have people from other farms, traipsing through our facilities. So just keeping that always, that biosecurity, that hygiene in the back of your mind, and having that sort of a mindset so you can maintain cleanliness throughout the season. And that's really about all I've got for y'all.
Well, thank you, Jenny. That was really informative. What causes the elbow lock position? Can it be size of lamb or conformation of the lamb?
Sure. Generally, unless they have, a frozen joint, we call it arthrogryposis, usually it has no long-lasting effect on the lamb's future. So it's just usually a factor of being squished up in the uterus. So just a positional abnormality.